Cancers, including leukemia, lymphoma, and myeloma, make up about 10% of all new cancer diagnoses. That's according to the National Foundation for Cancer Research. And that is today's Health Watch.
Yeah, so here with us today is Dr. Tara Gregory, a hematologist, oncologist, and medical director at the Colorado Blood Cancer Institute. We are so excited you're here with us today.
Thank you so much for having me. I really appreciate it.
Absolutely. Well, first of all, how is blood cancer different than other cancers?
Blood cancer is very different than other cancers in terms of the way that we screen for it. First of all, many cancers you have routine screening like colonoscopies, mammograms, as you know. Blood cancer is one of those insidious diseases. Either people are diagnosed just happenstance by seeing their primary care doctor, getting some blood count, something looks a little bit off, or they can become very ill and end up in an emergency room in an urgent care center.
Yeah, talk about those symptoms real quick. What are the symptoms that people can look out for, and are there any early warning signs?
Sure. Definitely, I think in blood cancer, it's important to know your body, how you normally feel. We're specifically looking at people who are losing a lot of weight rapidly. 20 pounds without trying in a month. It can be severe sweats, and I know a lot of us sweat at night. However, we're talking about drenching sweats, changing our clothes, changing the sheets. Those are some of the big things. Fatigue, not being able to get out and do the things that you enjoy, or even, you used to be able to mow the yard, no problem, have to do that, then go in and take a nap.
Okay, great. Yeah, it's great information. What's the treatment for those who have blood cancers, and what's the survival rate?
Our treatments have just been exploding over the last couple years. What I do today is not what I did 2 years ago. And each of those different cancers that you mentioned have very specific different treatments. I would say the newest thing that we're doing in blood cancer is that we're looking at how to involve our own immune systems in recognizing our cancers and fighting them off. And so we're calling that immune effector cell therapy, and that's become one of the most high growth areas in treatment right now.
Now, for those that have been diagnosed, or perhaps people that want to prevent this from happening, is there maybe like a recommended diet that people can use for maybe, or for even for treatment?
That's a great question. Right now we have about 1.5 million patients in the United States living with some form of blood cancer, either active or in remission. What we do know in terms of diet, both for prevention and then for maintaining your health while you're in treatment, is as close as you can get to the Mediterranean diet. So rotating proteins, lean proteins, whole grains, really moderate or reduced on wine intake, that sort of thing.
Oh, it's very interesting. Where can we find more information about blood cancers?
The Leukemia Lymphoma Society has a fantastic website. They also have a program where they can connect patients with other patients who have gone through treatment similar to what they'll go through and match them up together so that they have that personal resource as well.
Very insightful, Dr. Gregory. Thank you so much for joining us.
Thanks so much for having me. I appreciate it.
Of course. And if you want to see this interview or other Health Watch interviews, you could always go to our website, cbscolorado.com. We'll be right back.